Now, Wellness Wednesday on Fox 54 News, sponsored by Regenesis.
ADHD stands for Attention Deficit Hyperactivity Disorder. It's a developmental disorder that affects a patient's ability to focus and concentrate. It affects their executive functioning. And also, they can have difficulty regulating their movements.
The way I describe it to my patients, Carson, is it's a networking problem in the brain. ADHD, folks with ADHD, I tell them they have an awesome brain, but it's not the pay attention kind. It's the notice everything kind. And it's basically, the brain is organized into networks. And this is an oversimplification, of course, but it really helps people understand the challenges of ADHD. That the network for focus has variable activity. In other words, I describe it as having sort of iffy Wi-Fi. It comes and goes. And so when the video resumes, it may not be in the same place. So we tend to forget or have problems staying on task because the network is just not as well, it's not as well focused. It's not as activated is the word. Two things will activate that network: interest and urgency. So if someone with ADHD is interested in a task, they can pay attention to it just fine. Or if there's a perception of urgency, then again, it's much easier to stay on task. But telling a person with ADHD that they have a paper due in 2 weeks, the network is likely down. It goes down when we get bored or frustrated.
You want to look for, obviously, focus, concentration issues, hyperactivity issues, impulse control issues that are affecting the patient's ability to function. That's the standard. Everybody has some level of inattention. The question is, when does it become a disorder that needs to be addressed? The things that you're looking for, obviously, performance at school or the ability to be in a structured classroom and not be disruptive. Those are symptoms that become more problematic for children with ADHD that don't have it treated. Parents a lot of times, may hear from the teacher that the child has to be redirected to stop talking or to stay on task. Kids will daydream or doodle in class instead of doing their work. A lot of times they'll have incomplete work because they run out of time, because they're focused on other things or being distracted by other things in the classroom.
So first of all, everyone has occasional problems with forgetfulness and running late and procrastination. So, and all of those are symptoms of ADHD. It's when those symptoms become an impairment or begin to impact the quality of the person's academic, occupational, or social quality of life. And so we see this very often in kids or adults that are having those symptoms, but they're frequent enough that they're pervasive in their life enough that they really cause problems with their quality of life. There are 5 criteria. They're called the DSM-5 criteria. How many of the symptoms have they been going on for 6 months? Did they start before the age of 12? Are they present in multiple settings, at least 2? Are they having an impact on quality of life? Or would these symptoms be better explained by something else, like a learning issue or anxiety or other problems that may mimic ADHD? Sleep problems, for example, can mimic ADHD. So it's very important when getting evaluated that a more comprehensive exam and history be taken to make sure that those criteria are met.
So that's interesting. In a home setting, you ask a child to do something and it just doesn't get done. Maybe they go to their room to clean up and pick up a toy to put it away. Next thing you know, they're playing with it. So you notice little things like that in terms of having difficulty following directions, especially multi-step directions. Kids can be forgetful. They might tend to leave things half done. If they're doing a task, taking out the trash, not completing the task. So those are things that you can notice at home. A lot of times they might be very fidgety. I've had kids who just could not sit still, get sitting on the floor, moving around, rolling around on the floor. Jumping. I had one girl, she was doing back bends during the interview. So you can observe a lot just by looking at the child, and then listening to the parents report in terms of how they're functioning in different settings, typically at home and at school. It's not necessarily coded that way. Obviously you can look at the severity based on the level of dysfunction that it's causing. If the child is not able to be contained in the classroom, or is so disruptive they have to be removed from the classroom, that's interfering with that child's ability to learn. So there are different severities. I usually look at it, from three spokes. You've got the focus and attention, the hyperactivity, and the impulse control issues, and all those can have different extremes of each one that make up the individual's presentation.
Well, in so much of medicine, especially chronic conditions like ADHD or asthma or diabetes, the story is in the history. So listening to the patient is the most important thing. And of course, the parent. Getting input from the school or other activities that the child is involved in can be very helpful. So listening to the story is the most important part of the diagnosis. There is no single test that says, yes, this is ADHD or this is not ADHD. We use an FDA cleared test called QB test. It's cleared to improve diagnostic accuracy because it measures movement parameters that have been identified as being affected by attention or lack of attention. And it measures those things and then compares the results to a group of patients that don't have ADHD. So we can see that a 10-year-old boy usually moves this much and pays attention this well, whereas the patient may move significantly more and have more trouble with the parameters that measure attention, like reaction time and being accurate with responding to a dull task. So no test, including QB test, says yes or no, this is ADHD, but at least this test gives us objective data to go along with our findings on the clinical exam and history.
It can be life-changing for the child. A lot of times, especially kids in like lower grade school, first, second grade, they're trying to learn to read. The earlier it's caught and the earlier it's treated, the better the outcome for the child, because they don't find themselves struggling quite as much in the classroom setting. That also applies for the social and emotional aspect of the child's development, because sometimes ADHD can cause them to have difficulty having positive interactions with peers if they're very intrusive in other people's personal space, can't keep their hands to themselves, always interrupting. So those things can, like I said, both affect them academically and socially.
There's still a stigma, right? Parents don't want their child labeled. Adults with ADHD have likely, very many of them have been in the mental health system and been treated for anxiety or mood-related issues, because ADHD is associated with mood dysregulation and being overwhelmed by the symptoms of ADHD, not getting things done, procrastination, having lots of random thoughts, can look a lot like anxiety. And so it's the important thing is to trust that where you go has a system that is going to help you with an evidence-based diagnosis, and that if they're going to offer treatment, that they have experience in delivering that treatment. So first of all, there's the fear of the diagnosis, but the diagnosis is actually the freedom part, because when explained like the wonky Wi-Fi explanation, it resonates with parents and it destigmatizes, and they recognize that ADHD is not a way of being or an identity for the person. ADHD is a medical condition, after all. And so like any other chronic condition, it needs to be managed in like any other chronic medical condition. And so that will destigmatize, hopefully, the diagnosis. And then all parents, and to a lesser extent adults, but all parents fear that their child is going to be medicated, and they're going to lose their child's personality or the person. And what I always tell parents is there's nothing wrong with, or I tell the kid actually, there's nothing wrong with you. You're the person, right? But you have a medical condition that's a networking problem in the brain that we can fix. To a large extent, we can make a big impact on making things better for you with medication and a more comprehensive treatment plan, for sure. I just think that that it's helpful that we are rolling back the stigma of ADHD. Adults are coming to diagnosis more. It can be overdiagnosed if someone is not careful by applying the DSM-5 criteria. But we are having a lot of increased awareness, really since the pandemic, of people who recognize that this is what's going on. The internet is such a valuable resource, but don't get your diagnosis from there. That would be the other thing I would say. There are a lot of people online talking about ADHD, and they're talking about ADHD from their experience. And that's a very unique thing. So see someone who understands ADHD from a wealth of experience and people in having seen it in a lot of different settings and different types of people.
Well, ADHD is actually the most common psychiatric disorder in children. About 1 in 10 American children have been diagnosed with ADHD, so it's pretty prevalent. I know a lot of times people look at it as a disorder of childhood and adolescence, but a lot of times, even though the hyperactivity and impulse control symptoms have subsided as people mature, adults a lot of times still continue to struggle with executive functioning and with focus and concentration. So it looks different across a lifespan.